because I had always had employer-based health care for my entire adult life. So as I prepared to leave, I made sure I had set up my own policy, which I pay for myself. Because we wanted another baby, we looked into maternity coverage, but it's really cost prohibitive. It would cost me triple the amount every month to have a maternity policy, and most of them make you wait for a year before they'll cover you. So as we looked at our options, my OB recommended that I pay cash and avoid the insurance companies altogether. Turns out you can negotiate pretty much everything up front with the doctor and the hospital. I would drive across town to a small place to have my labs done and pay only 10% of what the big labs charge. My husband and I paid the anesthesiologist in the hospital room. Literally minutes after he stuck the needle in my spine, my husband was whipping out the checkbook to save us $300. We knew going in that we would need cash on hand, so we saved and we planned accordingly. Plus, I had my health insurance policy in case there was an emergency situation, I would be covered. My beautiful son, Derek, was born on March 26th of this year. He was a big full-term baby, and he weighed almost 9 pounds. But there was one little problem. He wouldn't breathe while he was eating. As I was feeding him after he was born, he began to turn blue. So they took him from me immediately to the neonatal intensive care unit. I was beside myself because I just knew they were going to keep him, and I was going to have to go home without my baby. So he ended up staying in the NICU for a week, learning how to breathe and eat at the same time, which he did learn. And we brought him home a week later. And we were just settling in when 2 weeks later I changed a diaper and I found blood in his diaper. We were pretty scared, so we went right to the pediatrician. While they were testing his stool, the girl at the front desk of my pediatrician told us that our insurance had refused to pay for his first 2 well checks because there was a 6-month waiting period. I figured it was just some sort of mix-up, but it wasn't. Because he was added to my policy, which has a 6-month waiting period for well checks, they imposed this waiting period on my infant son at birth. So none of his immunizations or well checks were going to be covered for 6 months. While I was digesting this information, we found out that he was severely allergic to cow's milk protein, and that's what was causing his bloody diarrhea. So we were sent to a pediatric gastroenterologist, and he prescribed a very expensive formula, and I say prescribed because you need a prescription to get it from a specialty pharmacy. You can't get it from Walgreens or Target. I asked if I could breastfeed, and the doctor advised me against it, saying that it would be too hard for me to eliminate milk and soy from my diet. But I did a lot of my own research because I felt that it was the most natural thing for me to do. So I tried, and I failed. After a month on a really drastic diet where I ate only rice and chicken, he still had really bad symptoms. I held my breath during every diaper change, praying that it wouldn't be bloody. I inspected poo on a daily basis, and every time there was blood in it, I felt like it was my fault. I wanted to breastfeed my baby, but when I did, I was poisoning him. So our only alternative was a prescription formula. It cost $50 for a small can. Our insurance company will not cover it. Even with a note from our pediatric gastroenterologist saying that it's the only food my son can eat to survive. They pointed out that it's in our contract, and I checked, and yes, it is, in section 43H, with other non-covered items like health and beauty aids, batteries, and appetite suppressants. So the only food that my child can eat to survive is lumped into the same category as makeup, batteries, and Slim Fast. It's about $200 a week to feed our growing baby right now. We have resorted to buying formula on eBay, where we're able to save a little bit of money. So here's where we are right now. Derek's stay in the NICU ended up costing us over $7,000, and that was with health insurance. Our maternity bills totaled $5,200, so we have over $12,000 in medical bills. We're paying cash for our son's well checks and immunizations, and we're facing huge expenses to buy our only food that our son can eat. And we pay over $500 every month to have our health insurance policies. The good for infants who have health insurance, regardless of waiting periods. We have a patchwork system in this country, so not everyone benefits from the smart, sensible decisions that are made by state lawmakers to raise standards of care. I believe that we need to reform our healthcare system at the national level, and I'm sure my son does too. Thank you.
I come to you as neither a Democrat nor a Republican. I come to you as a physician, a father and a husband, and someone who's concerned about the future of American healthcare. This is the reality that I face in my clinic Every week, I come across patients who are losing their jobs and consequently their health insurance. Every day, some people cancel appointments as they cannot afford them. I see bankruptcy notices on my desk very frequently, some of them due to healthcare costs. And all too often, I have to call insurance companies and appeal their rejection of tests that I consider necessary for my patients, which in effect is rationing healthcare. There are some insurance companies who don't even allow me, a primary care physician, and my other primary care colleagues to see my own patients in the hospital, thereby restricting patients' choice of physicians.
Why don't you name those insurance companies so we can boycott them?
I see people whose premiums and healthcare costs are rising. Just like my own families, these additional costs are added on without any form of additional benefits being offered. The threat of frivolous lawsuits drives up the cost of healthcare and makes it increasingly less affordable for those of us who have health insurance. Not a month goes by without insurance companies denying benefits and payments for what is deemed to be pre-existing. Often I see people whose insurance plan will not pay for prevention and wellness, which would have prevented them from developing serious illnesses in the future, which then would cause an exponential increase of healthcare costs. I support President Obama's healthcare reform plan as it gives every American a choice of affordable health insurance and healthcare. It will prevent insurance companies from selectively covering patients, thereby increasing access to healthcare. It will provide sliding scale subsidies as refundable tax credits to those who cannot afford or get employer-based coverage. The President proposes to reduce costs by addressing the issue of malpractice reform, which is pivotal, by reducing wasteful expenditures, by making health plan administration more efficient, by making healthcare more affordable, by allowing individuals and small businesses to purchase coverage through a group purchasing pool at competitive rates, similar to that offered to federal employees, covering prevention and wellness. The plan ensures our health delivery systems, such as practices and hospitals, remain economically viable by one, reducing the number of uninsured and ending the cycle of Medicare cuts. The President's plan ensures competition and facilitates choice of physician and insurance plans. My friends, now is the time to act. Otherwise, there'll be more uninsured, more bankruptcies due to high medical bills, and probably a Medicare system that goes bankrupt. The question that I pose is, what is it that we have to lose in supporting a plan that provides the most basic of life's necessities, that only further reinforces one of our most fundamental values, which we all cherish, of us being a part of a caring and compassionate society. Thank you.